I'm Dr. Rima Dada. I'm a professor at the All India Institute of Medical Sciences, New Delhi. It's India's largest tertiary research and referral hospital. And I am basically in charge of the lab for molecular reproduction and genetics. And I am engaged in teaching patient genetic diagnostic services, counseling, as well as research. And my work actually entails working on the effect of yoga on the genome and epigenome in complex diseases.
That's extraordinary. That's totally out of common field of research and uh, medical medical approach. Let me know better. What do you mean when you tell us about All Indian uh, Institute? Can you tell us a few more words about this institution, because it seems to be a governmental institution, resources from the assurance, health assurance from India, I suppose. Which is the goal of this institute?
Yeah, the All India Institute of Medical Sciences in Delhi is India's largest research and referral and a tertiary hospital. Now, there are several similar institutes which have been established in different parts of India, but this was established in 1956 by an act of parliament, which states that this is an autonomous body under the institute, under the Ministry of Health and Family Welfare, and it has three main objectives: excellence in patient care, teaching, and research. So we have a large number of faculty. Each one is engaged in different aspects of patient care, diagnostics, teaching, as well as research. And the most of the services in this institute are free because they cater to poor people as well as to different strata in society. And but we have the best doctors and very highly accomplished in their various fields, and we have very many super specialities and state of the art labs which are there present in the institute. And this is sort of a model institute for various other institutes which are developing in the country.
Yes, I would like to address you one more question related on this topic, because I know that, for example, in China there is over 250 faculties of Chinese, traditional Chinese medicine, and also in India there are a lot. I don't know if the same, but I know that the standards of minimal or premium education is a goal for some network of institutions from India. Can you tell us about your institute? Is it involved in educational standards in the faculties of Ayurveda in India or not?
Actually, in India, we are in the All India Institute of Medical Sciences. We have recently, in the last 3 years, there is a Center for Integrative Medicine and Research, which has been established by the government, and several institutes of repute, especially these institutes dealing with Ayurveda and integrative medicines like yoga, have been established. They are independent institutes, and they have also been established with institutes which are offering allopathy or modern medicine, so that we can adopt an integrated approach in management of diseases. And so we do have several collaborations, and in the last 3 years alone we have over 30 collaborations which have been seen between various clinical departments which are offering both modern medicine treatment as well as an integrated approach using Ayurveda and yoga.
So thank you. This is very interesting. We in Romania we also have a National Research Institute on complementary and alternative medicine here in Bucharest, who's entirely on the Minister of Healthcare and Education. So this is also the single authority in establish the quality of teaching in this field of complementary and alternative medicine. So this is the entity that approve the programs and educational, educational curricula. So coming to you, you are working into this institute, and you will present a topic into the conference, into our Ayurveda and personalized medicine. We call this international conference as personalized medicine, tradition, innovation, and digitalization. So the most important section of this year is Ayurveda. So you are preparing a presentation on your field of preoccupation. Can you tell us a little bit of regarding this presentation?
Yeah, I would be presenting to you how yoga can play a very important role in both promotion of health, prevention of diseases, as well as in the management of complex lifestyle diseases. And it's very important to understand that in the recent decades, there has been a huge increase in the incidence of complex lifestyle diseases. Now, these are diseases like hypertension, stroke, Alzheimer's disease, depression, autoimmune diseases, cancers. All come under this umbrella of what are complex diseases. So, what are these complex diseases, which are also sometimes called lifestyle diseases? These occur due to the interaction of a large number of genes, so they are polygenic. Each gene has a small additive effect. Plus, they also involve a huge number of lifestyle factors and environmental factors. For example, and the reason why there has been a huge increase in the recent decades is because of our sedentary lifestyle, because of it's been seen that we are having unhealthy diets, unhealthy social habits like smoking, alcohol consumption, a diet which is nutritionally depleted but rich in trans fats, salts, and sugars, which is calorie dense, and then lack of physical activity. All these factors have led to a huge increase in the incidence of these complex lifestyle diseases. And it's very difficult in this age of super specialty for having a very targeted approach to managing a particular disease. For example, if a person has depression, it's believed to be a disease of the mind. But when you have depression and you have, it's been seen that not only does it involve cells in the brain, but it impacts every cell in the body. People with depression, and it's been seen in the COVID era, there has been a huge increase in the number of cases experiencing stress, anxiety, depression. This depression will also impact every cell of the body. It causes psychological stress. It also it causes early premature aging, and therefore an earlier onset of complex lifestyle diseases. And thus, it's important to realize that we need an integrated approach to managing these diseases. And therein, yoga plays a very important role. And you'll see during the course of my talk that how there are several common underlying factors. There's a common underlying architecture which is forming the basis or the underlying etiology of various complex lifestyle diseases. And yoga actually targets each of those factors. Like I've been working for the last 15 years on primary open angle glaucoma, depression, rheumatoid arthritis, unexplained male factor infertility, early pregnancy losses due to the male factor, and now we've started work on another some problems which are highly prevalent like polycystic ovarian disease, accelerated aging. And in all these conditions we see that yoga can have a tremendous role and is a very powerful adjunct in the management of these complex diseases.
Super. This is exciting, and I would like to thank you for these preview details that you just offered. I would like also to ask you because in our previous talk we had a little bit. Uh, Mentioning your program of teaching. Do you also have teaching teaching activities by your common schedule? You are teaching this also? Please let me know if it's only a research or it's also some.
I think
Sorry.
there was a break in connection.
Yes, yes. So, are you teaching all this knowledge that you told me about teaching, that you have some classes? I well understood?
Yes, though I'm teaching anatomy as well, and also I guide some MD and PhD students, but we do have classes on epigenetics, and I take that class, and where we tell people that initially it was believed that your phenotype is just determined by your genetic constitution, but now we know very well that there is something that operates above the genetic landscape, and that is the epigenetics. And that is how our genome, how our genes, their output, their behavior of the genes, their expression of the genes can be modulated by our thoughts, by our behavior, by whatever we do on a regular habit, in a regular way, and whatever we do repetitively. So we've seen in our studies that when people do yoga on a regular basis, they switch on gene programs which are beneficial for us. For example, the genes which are decreasing inflammations, the genes which are coding for antioxidants, the genes which are helping to maintain the telomere length, the genes which are actually causing changes in the brain function as well as structure, increasing the gray matter of the brain, decreasing stress, the expression of those genes actually goes up. So it's very, very important to understand that though you do have certain diseases in which when you have a gene mutation, it causes the disease, but on the other hand, there are a large number of genes and their expression can be changed by adopting a healthy lifestyle. And yoga has tremendous transformative power, and it can actually modulate the expression of various genes and switch on gene programs which are beneficial for us. And that we actually teach the students who are doing MBBS, MD, and PhD.
MBBS, please help us to discover these abbreviations because here in Romania and Europe, we are not aware of them.
Now, these are the students who have enrolled for becoming doctors. So those are the undergraduate and the postgraduate studies. So some people are doing undergraduate, postgraduate studies, and some people are just specializing in a particular field. So they are doing PhD, or that is a research program.
Super. So let's repeat again. All India Institute for Medical Sciences. This is
Yes.
the framework. Thank you. When you will be with us with your presentation Saturday, if I remember well, can we?
I think I'm on Friday.
Oh yes,
Friday at
Friday.
around 10:30. It's on 28th. My talk is on
Yes,
28th,
yes.
and that's at 10:30 Romanian time, so around 12:30 Indian time.
10:30 Friday. It's very probably that it's to hurry up because we have the opening at 10, so maybe a little bit later than 10:30, but immediately after. Thank you.
Okay, thank you.
For this. Thank you for this talk. We want to familiarize people from Romania and all the people that are following our event and are speaking English. Thank you very much.
Thank you.
See you.
Thank
See you
you.
at the conference. Thank you.